Good morning, friends. This is a short demonstration of TPTS in a distal radial fracture by Dr. Sushil Chaudhary of Ajmer. You can see a combinated distal radial fracture with a Diller-Fogg deformity. This was a closed fracture. First, the fracture is reduced under C-arm and anesthesia by traction, volar flexion, and ulnar deviation, and then anteroposterior and lateral views are taken to see that the reduction is accurate. Now we are going to fix this with the Tangari Prakash Trauma System that involves a combination of intra and extramedullary fixation using thin 2 mm wires. A radial wire is first passed right up to the head of the radius. The second radial wire is passed dorsally and again negotiated through the fractured fragment very carefully. As the wire is bent in a gentle curve, we can ensure that it does not perforate the opposite cortex. That is the most important step here. In case the wire is not going in the right direction, it has to be withdrawn, rotated, and again pushed in so that we get the right direction and the two wires are intramedullary and diverge in the form of a funnel. In this video, I shall repeat a few steps to ensure that there are no mistakes in understanding. We can see that the both wires have reached almost up to the head of the radius. They are divergent, and now the wires are bent at 90 degrees to the skin to avoid skin irritation. This is an essential step before clamping. Once again, I am showing you how the wires go deep intramedullary. They are divergent and reach right up to the opposite cortex, and then the wires are bent at 90 degrees. Both the wires are bent at 90 degrees and again bent at 90 degrees to accommodate the clamp. The special instrumentation in the form of benders and pliers ensure that the bends are parallel to each other and the clamps can be snapped in without causing post-operative discomfort to the patient. This is an important step and is being repeated for you again. The wires are bent at 90 degrees, then again at 90 degrees, so that the two wires are exactly parallel to each other. Now we leave a gap of about an inch and a half and then bend the wire again at 90 degrees so that the clamp rests above the skin, giving it plenty of breathing space. The clamps are so special that irrespective of the parallelity, the wires will snap in. But as shown again in the video, it is essential to see that the wires are as parallel as possible to get the best anchorage in the clip. The clips are automatic. These are the special Tangari Prakash clamps, and into this the wires will snap in. And once snapped, will become extremely rigidly fixed. With a special Allen key, the clamp is tightened, the fracture stability is checked, and the wires are cut. You can see that this is such a small, elegant, and simple procedure taking less than 10 minutes time, and achieved accurate reduction without the need of plaster immobilization or the fancy invasive distal radial plates. This TPTS system is based on an invention by Mario Tangari of Italy and on the principles of Mirage, and the Indian Academy of Orthopaedic Surgeons is very proud to introduce this for the first time in India. Thank you.